You've heard the word mastopexy before, but do you really know what it is? I'm Joubin Gabbay, I'm board-certified plastic surgeon in Beverly Hills, and I want to talk to you about all things plastic surgery and explain to you the stuff you need to know. So a mastopexy is also called a breast lift, and it's an operation that is ideal for women who've had a drop in their breast after any number of sort of big lifetime changes. So the common situations where you might have a drop in your breast, of course, include aging, after pregnancy, after significant amount of weight loss, or any other numbers of things that can cause just an evolution of your skin. And what happens a lot in these situations is the breast initially fills out, and through, let's say, the hormones of pregnancy, breastfeeding, stuff like that, or even in prior areas of weight gain, things get bigger and the breasts stretch out that skin. But over time, let's say after a pregnancy, after weight loss, again, after life stuff, the volume inside the breast will go away and it'll drop down, but that skin doesn't change. The skin, to a large extent, is not able to shrink back down with the breast after a certain point, and it just droops down because there's nothing inside holding it out again. So the core idea of what to do in a situation like this is, first, you want to reduce that extra skin in the breast that is no longer able to pull things back up. And then you want to reorganize the whole breast tissue, actually, in order to bring the nipples so that they are facing up and forward, and then just tighten the whole breast up together to keep things lifted, to restore a youthful and natural looking contour to the breast. So, how do we do that? There are a lot of different ways we can go about changing that breast orientation. And again, at the core is what you do with the skin and then what you do with the tissue inside the breast. So the main thing with a breast lift is we usually don't take that nipple, just kind of take it off the body, reorganize things, tighten it up, and just slap it back on. We always keep the nipple and areola attached to the body, attached to the blood supply in the body. Most commonly in my hands, I have the blood vessels coming either from the upper inner portion of the breast or just from the upper portion of the breast, and the blood vessels go down to the nipple and areola. They always are there to feed that tissue to keep it alive. Then what we do is, believe it or not, in a lot of cases, we kind of open up that breast. We will remove a bit of excess breast skin. We will often also remove a little bit of excess breast tissue. We will free up the nipple and areola so it can actually move around a lot and lift it up into a new position, and then re-wrap that breast with the reduced skin, with the nipple in the new position, to create a beautiful, natural teardrop shape to the breast that's youthful and back to where you wanted it to be. Now, every surgeon does their own thing, and I have a lot of approaches that are specifically mine. I do a lot of things that make my approach different from another surgeon, and I think give my patients the best results. A really important concept here is to use the entire structure of the breast to provide strength and solid, just definition to the breast to make things resistant to future change. Because listen, gravity and aging always happen, and you want to fight it every single step of the way. Another really important approach that I take that not a lot of other surgeons do, but I think is so powerful, is something called an auto-augmentation. And here's the thought. A lot of women who have a drooped breast have also a little bit of extra breast tissue down in the lower portion of the breast, where when you're trying to wrap things together, that tissue can get in the way, and many surgeons will simply cut it out and literally throw it in the trash. Well, I don't like that. I think it's important to use that tissue whenever you can to get back inside the breast and put that tissue in a place where you want volume. Very often I can put it in the central or even upper portion of the breast to provide cleavage, to provide fullness in an area that would normally be a little bit more flat. That can help restore the volume that you so desperately want and need sometimes, because after volume loss in the breast, every little drop counts. And to that end, we may often add a breast implant as a part of a mastopexy or breast lift. We may add fat. There are even increasing uses of fillers that are really specifically made for the breast and body that can add this type of volume. So this is an approach that is so much more than just, hey, let's lift it up and see what happens. It's an approach that looks at the whole breast, looks at every bit of tissue you can use in that breast and uses all that tissue to the advantage of creating a beautiful and natural shape for you. So what are the things that can be done after the breast? We're going to talk about that at length, but really at the end of the day, what a breast lift does is it will restore the natural shape of the breast into a more youthful and elevated position. The nipple and areola will point forward rather than down. We may remove a fair bit of skin. We may remove a fair bit of breast tissue. We do all of those things to restore that breast shape and make everything where it once was. Incisions are so important with every single breast lift that we do. And in general, there are 3 different incision patterns that we use with our breast lifts. There's the donut scar. That leaves you with an incision just around the areola. There is the lollipop scar, so incision around the areola and a vertical scar down the lower aspect of the breast. And the anchor scar, incision around the areola, vertical scar, and a horizontal scar, either anywhere from a very tiny limited one or literally from the beginning to end of the breast. Those are the keys to reducing skin in the breast and helping to elevate it up, because you got to take that skin out in a way that's going to get rid of what's extra, but also help shape the breast into the most beautiful and natural position. Now, the way we decide between one incision and another is usually based on several factors, including how much your breast droops, how much loose skin you have, the specific surgical approach each surgeon takes, and the best way to get that result that you want. I don't believe in using one approach across the board. I customize every single approach I take to my patients to their specific needs and to the goal that they're looking for. So we may do a donut, although, side note, one very big thing that I do is I don't like to do a lot of donut lifts because they can tend to stretch out and flatten over time. I don't love that. We can do the lollipop lift in specific cases. We do an anchor lift. What you need is what you get, and that's the best way to give you the best result.